Hi, everyone, and welcome. Thanks for joining us this afternoon to talk about a really exciting topic, the new Guardian Connect system. It's the first smart CGM and comes exclusively with Sugar.IQ, so we have lots of exciting things to talk about today. I'm Carrie Hallbaker from the social media team here at Medtronic Diabetes. I'm here with Louis Diaz, our Chief Patient Officer. Say hi. And a new guest. You're probably familiar with Louis, but a new guest in Todd Rubin, who is the Vice President of our Connected Care business.
Hi, everyone.
So we're gonna spend some time. I'm gonna ask them a few questions, and we're gonna talk a little bit about this exciting new product. Just a couple of housekeeping items up front. We do have FDA approval for this product that we've just recently received, which is why we're here talking to you today. However, when we get an FDA approval, it does take us a little bit of time to ramp up operationally. So we are looking at late summer in order to be able to start shipping. So after this Facebook Live, if you're as excited as we are and you want to stay up to date with us, the best thing to do would be to go to medtronicdiabetes.com/GC for Guardian Connect. And there's a form there where you can fill out and in order to stay in touch with you, and we'll keep you updated. Also, when you go to the website, that is where you can find important safety information about this product and the rest of the Medtronic group of products. So how about we just kick things off? If you guys just have any words of welcome you want to say to the community?
Sure, absolutely. I just want to say first and foremost that we are thrilled to be welcoming a new family of patients thanks to Guardian Connect. This allows Medtronic to really extend our offering of diabetes therapies to a whole new family of patients. Secondly, I think we're all delighted. I think our employees are extremely delighted and proud. We've been working very hard on Guardian Connect, and this is a great chance to kind of enter and create a new category. So a lot of hard work that has come through. And finally, we're very thankful for all our partners. We have partnered very closely with the FDA. They've been very engaged, and so we're very thankful for, in the last few days, for their announcement and approval of Guardian Connect. Now, Guardian Connect is a standalone CGM. It's really a new category of CGM, and it is targeted at a new type of patients that we have not served in the past. These are patients that have selected a different lifestyle than using a pump. If you want like a pump and a CGM, we have created MiniMed 670G. That is a wonderful system. We've heard wonderful stories about MiniMed 670G. It automatically adjusts to a patient's lifestyle. It's absolutely fantastic. But we also wanted to create and extend our portfolio of therapies to a new set of patients. And so we are primarily with Guardian Connect offering patients that selected to use injections or to use pens and that are on multiple daily injections to try Guardian Connect. All in all, Guardian Connect, I think of it as a new chapter. It is smart. It is first. It is only in a lot of categories. So you'll hear me and Todd talking about how this is a lot smarter. It's the first and only CGM that can offer a lot of new and unique benefits. So we're absolutely thrilled and delighted to be talking to you about Guardian Connect.
Yeah, the team's so excited to finally have FDA approval, to be working towards commercial availability later this summer. And I'd be remiss not to just thank the diabetes community for all their help and support. We don't design and develop products in a vacuum. It takes the community to get the input and feedback, so we do it right. And so a big thank you up front.
Yeah, I couldn't echo that more. Just thank you to all of you and all of your interactions with us. So Todd, it's you and your team who are responsible, with the help of the community and many others, but who are bringing this to the diabetes community. You want to tell us a little bit more about it?
Yeah, sure. As I mentioned, the team's incredibly excited. It's our first smart standalone CGM. When we started designing and developing the product, we gave ourselves a challenge, which was how could we take standalone CGM one step further? How could we make it a bit smarter? And I think you'll see in a number of different ways how we went about doing that. A couple that I can just to share with the audience. The first, we started by looking at how can we make the data from CGM, more useful, more actionable for our users. And so you'll see that Guardian Connect is the first and only standalone CGM that actually alerts users 10 to 60 minutes in advance of a high or low glucose event, so that they can actually take action. They can actually intervene and hopefully prevent going high or low. So we're really excited about that. We think that's certainly a lot smarter. We also, in talking with a lot of users, one of the themes that came up in our conversations was how we would talk to folks that say how diligent they were in managing their diabetes, intensely they manage it. They're doing the same things day in and day out, and yet for whatever reason, they're having different results, right? Different days, and just the general unpredictability of managing diabetes. And I know it's incredibly frustrating. So we got together with our partner IBM and we said, how can we take all this data that we have, glucose data, insulin data, food data, and do some of that hard thinking work for our customers. And so we're very pleased to be announcing the launch of our Sugar.IQ Smart Diabetes Assistant. It's a complementary app that goes along with Guardian Connect. And among its other features, one of the things it does is it gleans insights from all of that data to help prod or give little nudges to our users so they can make small changes in their day-to-day management that hopefully make a big difference in the success of any given day. So we're really excited. We think it's a lot smarter and excited to get in the users' hands.
It sounds, really great, and I love what you were, talking about is that we do hear from the community so often is how challenging it is to really understand those patterns and trends, and I can't wait to dig into Sugar.IQ in a minute. But first, can you just break down the pieces for us? What is actually included and involved in this system?
Yeah, sure. It's a great question, Carrie. One of the, actually a big deal for Guardian Connect is the fact that it's the first and only standalone CGM that actually transmits data directly from the CGM that you wear on body to an iPhone, to a smartphone. And so it has a number of advantages. Number one, you don't have to buy a separate receiver, so it's more affordable. And then secondly, you don't have to carry around another device just to look at your glucose levels. So we're really excited about that. The system, in terms of its components, is simple. So you can wear a sensor on your upper arm or on your belly. The sensor is connected to a transmitter, a sleek transmitter, which is Bluetooth enabled. And so that sends glucose values every 5 minutes to the smartphone, to your iPhone app. And then I don't have the app up, but then on your app you can actually see your glucose values, your trends. You can receive alerts and notifications. So we think users will really like it, and it's responsive to user feedback around not wanting to carry around another separate receiver.
I saw you gesturing at the arm. That's some relatively new news for the Medtronic community, which is that we have approval for the stomach and the arm.
That's exactly right. So we announced in, I guess, late February that we have approval for use in the upper arm. It comes with it some excellent accuracy data, performance data of the sensor. So we've gotten great feedback from folks in the community, particularly those wearing MiniMed 670G and the Guardian 3 sensor, Guardian Sensor 3.
Right. So Lewis, let's talk a little bit about what's different in this system. I think that's what you guys are probably really wondering. What's different in this from other CGMs?
Yeah, sure. I think that Todd captured a lot of the unique differentiators that make Guardian Connect really unique. But it all started with the patients. And, I remember us talking to a college student, just the meals, just a lot of the activities being in the middle of the night. And so you kind of start to think about, there needs to be a guardian, someone to kind of watch over, someone that has a very awkward, irregular kind of schedule. I remember a 55-year-old out in the middle of Florida forgetting about when to take medications, forgetting about what to do. And so we've designed Guardian Connect with these patients in mind. And you've heard a lot of what we've designed. The 5 big differentiators are clearly direct display on your smartphone. That is smarter. That's the first and only CGM, standalone CGM, that does that. The first device that allows predictive alerts, 10 to 60 minutes. You choose if it's 10 minutes that it alerts you, if it's 60 minutes. You have a choice. The first and only standalone CGM that comes with Sugar.IQ. This is a tremendous, huge advancement. Sugar.IQ enables a conversation between the patient and this assistant that's always there, that's giving you patterns, that's giving you help at the right time, just the right help. So, and in addition to that, we've got a great sensor, the sensor that powers the MiniMed 670 hybrid closed loop. That's been approved, by the FDA. So great accuracy. We bring the power of the Medtronic family, great service, CareLink. So these are a lot of great differentiators that really no one has. So I'm absolutely thrilled that this is the first system, the only system, a really smarter system for our patients that really need a little bit of help, that have chosen a different approach to taking care of their diabetes. You might love the pump and CGM, MiniMed 670 is there for you. You want a different choice, you want a different opportunity, a lifestyle choice of using pens and injections, MiniMed Connect is just right for you. So we're just absolutely thrilled to be inspired by our patients.
Awesome. So you mentioned Sugar.IQ. Todd, how about we dig into Sugar.IQ a little bit? We're talking IBM and a lot of advancements. So what's someone with diabetes really going to experience with that app?
Sure. Yeah, it's a great question. We've very fortunate to have a strong partnership with IBM. When we initiated the partnership, we were looking at how could we marry their deep analytical, cognitive computing capabilities, combine that with our expertise in terms of product development, particularly and diabetes management. How do we bring those together again to alleviate some of the thinking in terms of day-to-day work involved around managing your diabetes with a personal diabetes assistant? So that is Sugar.IQ. I mentioned it has a few great benefits. One is just the insights. The Sugar.IQ app learns as it gets to know you through your data and will provide insights as it uncovers patterns. These can be everything from identifying that perhaps you don't realize, but you're waking up a bit high a few mornings a week, and it can notify you. It could be an insight around a particularly troublesome food, but you're getting a constant or a regular stream of insights based on your data to help you manage the day-to-day. There's also a really great feature which I like, which is our glycemic assist feature, which allows you to tag specific foods or macronutrients so that you can understand over time your body's unique response from a glucose perspective to those foods. Today, it's Southern California. It's Taco Tuesday. Not that I'm advocating to go out and eat a ton of tacos, but I would say, you can, as an example, you could tag my favorite fish tacos. I can follow my body's reaction over time, so I can enjoy those tacos, but also know how to manage it from a diabetes perspective. And then lastly, there's a great little feature and screen called the My Data screen. And we found in testing, users really loved it. It's simple, it's elegant. It gives you your basic hourly and daily glucose statistics, including one which we know a lot of folks in the community are using a lot more frequently, which is your time in range. And so it's always there on your iPhone, so you know how you're doing, and you can check your progress.
Yeah. And Todd, if I might add to it, Sugar.IQ is number one, it's free.
Correct.
It is absolutely free for all the Guardian Connect users. Secondly, it is part of a partnership with IBM, so the same sort of brain power that is now, knows what you want to shop, knows, provides you advice in the big Internet of Things, the same kind of computing power that helps you take you on a road trip from point A to point B. This is exactly what Sugar.IQ, it's helping you go from point A to point B, providing you advice just at the right time. And it's absolutely fantastic, the type of advice that it's giving you. It might just give you you're doing great, keep going. It might just give you hey, we've noticed that at this time, with this type of food, you might want to consider this. So it's a really great conversation that Sugar.IQ has with the patient. It's a really fun interaction, so a different way of relating between diabetes and the patient.
Absolutely.
I love the motivational insights that you mentioned, because I think who in our lives couldn't use a little bit more positive reinforcement, right? And that's there to kind of, from my understanding, is to let you know when things are going well, because that's just as important as knowing when maybe there's something you want to adjust.
That's absolutely right. Yeah. We found in our testing, users absolutely loved it. It's always good to get a pat on the back when you're doing well.
Yeah. Fantastic. So, Louis, let's talk about care partners. So now, of course, the Guardian Connect system is approved for people aged 14 to 75, but we know that this is an important technology for care partners. Something else that you guys have always shared with us is that for many people, managing diabetes is kind of a team activity. So how could care partners benefit from this?
Yeah, absolutely. Family plays a big role when we're bringing new therapy innovations to the marketplace, like we did MiniMed 670G. We know that the family's a big part of it. In the process of bringing new innovation, we have to make choices. In the case of Guardian Connect, we made a big effort to speed it to the marketplace with the family in mind. And so we are enabling the family to receive text messages on any device, whether the parent, the mom, the cousin has an iOS device, an iPhone, or as an Android device. They can receive these text messages, in addition to obviously the patient.
Even the smart watches.
Even
right?
a smart
Wherever
watch.
You can get a text message.
Absolutely,
right?
absolutely. So, and the other piece of advantage is that Medtronic provides a care link, which is a personal software that allows not only the patient, their doctor, as well as their caregiver to keep track of what is going on with the patient. And that is real time, that is very fast access to that data. So we want the patient, we want the doctor, the nurse, we want the caregiver to all be involved in helping out. And we think we've done a pretty good job of doing that with Guardian Connect. So we're thrilled with that. I would be remiss, Todd, not to show not only the phone, but which you guys are familiar, but also another big advantage is our serter. It's a single hand kind of serter. You've seen the phone. You've seen clearly the transmitter, and you've seen really the smart watch. And those are really the 4 or 5 simple devices that really pull Guardian Connect and make it really unique. There's no additional other device controller. It's that simple. So we're thrilled for the patient as well as for the family.
Right. I hope you guys are asking some questions. We'd love to answer some. Are they here? But while I check those out, how about Todd, you tell us a little bit about availability.
Yeah, sure. So as you all just know, we just got FDA approval, which is a big milestone. It means the work's really just beginning for us here within Medtronic, as we have to ramp up preparation from a service perspective, a product and operational perspective, so we can make sure we have a seamless experience for our customers. So we're looking at officially commercially launching later this summer. Very excited about it. In the meantime, as you mentioned at the beginning of the session, you can go to medtronicdiabetes.com/GC if you'd like to sign up for more information. You can also text the word SMART, S-M-A-R-T, to 22094. And it's just another way of us keeping you up to date on our progress and bringing this to market.
Fantastic. So we have a couple questions here. The first one is, no surprise, Android, when we have something for Android, Todd.
Yeah, absolutely. I'm obviously very excited. We all are very excited to bring this to Android. We have a great partnership with Samsung, who's helping us do that. And there are, of course, just a ton of users out there in the U.S. and around the world who can benefit from having Guardian Connect and Sugar.IQ on Android. We had to make some choices as a business. This was to figure out sort of stepwise how to go. So we're launching with iOS for Apple, but that's high on our priority list to bring this to Android in the coming future.
Fantastic. I think that'll make a lot of people happy, we know.
Absolutely.
There's a lot of folks of you out there who use Android. There's also a lot of you in our community who it's always wonderful here, are having great success with MiniMed 670G. So, Louis, another question was about this connectivity capability, being able to see the diabetes information on your phone. How about for our MiniMed 670G community?
Sure. So we're very, very aware of your need and of your need for more connectivity with the MiniMed 670G system, and we're very actively working on delivering that. When we brought MiniMed 670G out, we had to make some choices. We thought that the ability to have smart guard technology, the ability to automatically adjust to your lifestyle, to your glucose levels was very important, and so we've pushed that with the help of the FDA and a lot of other partners to the market as fast as we could. With Guardian Connect, we had the chance to build more connectivity, and so we're thrilled to bring that, to bring the Bluetooth capability. The CGM connects and talks directly to a smartphone. So we are bringing these innovations as fast and as soon as possible. We're actively working on bringing new innovations to the marketplace. We cannot wait to bring more connectivity to the MiniMed 670G system. I hope, though, that right now we've got a lot of testimonials that it is a great device, brings a lot of peace of mind. It's bringing a lot of joy to families. So, but we hear you. Sooner the better. We hear you, and we'll do it as fast as we can.
And this is a step in the right direction, right? Having this type of transmitter, but of course with a larger system, there's a few more pieces and a few more steps to go through, right?
That's right. It's
Absolutely.
a critical milestone for us on that path.
Yeah. So that's another reason to be excited today, I think. Yes. And then I think we have one question was just some clarification about being the first to go to a smartphone without the receiver. I think it sounds like maybe you're asking about without the receiver part. I think if I'm interpreting that right. So, Todd, do you just want to go over that again about how we're the first in that area?
Yeah, sure. Just to reiterate, it's the first standalone CGM system that transmits directly from the transmitter via Bluetooth directly to the smartphone, to the iPhone, as your primary receiver. So really excited about that, and it was an incredible regulatory milestone for us to accomplish that.
And not only can you see your glucose values in your smartphone, in your iPhone, but you get push notifications to your smartwatch, to your iWatch. So so there's a little bit of us expanding and providing more accessibility for all of the patients to see more of what's going on.
It's a really exciting time. I think the community has been hearing from us for the last couple of years about how we really want to go beyond being, just known for pumps and sensors that work together in integrated systems. And for me, I think it's really exciting to be here, to be part of the team, as we really see ourselves broaden into helping with people with diabetes, no matter where they are on that journey in many different ways. And Guardian Connect is so exciting. Is there anything else we should close out and share with our community?
Just a reiteration of a thank you to the community. We do this for you and couldn't do it without you. So really appreciate all the feedback and input and welcome it along the journey as we move forward as well.
Yeah.
And I just want to say that that this is really Guardian Connect is really a new chapter in diabetes. I think it allows a lot of patients to start to outsmart their diabetes. It allows a lot of patients to learn more about what's going on with their lives, with their glucose, insulin, so on and so forth. So it's really smart. It's the first and only in many aspects. And we hope that with Sugar.IQ, it's kind of supercharged patients' lives to have better health outcomes and feel a lot better about their diabetes. So we're absolutely thrilled to bring Guardian Connect to the marketplace.
Yeah. So if you're someone in your community and you're interested in this, please do stay connected with us. Continue to engage with us on Facebook and Instagram, and go to our website. Medtronic Diabetes /GC is the place where you can find that form where you can make sure to get some direct communication with us as we go through this journey from FDA approval to shipment later this summer. So thanks, everyone.
Thank you, everyone.